Just culture is the foundation of a safety culture. We all make mistakes all the time. It's just in healthcare, the ramifications can be really, really serious.
My mom was one of those incredible people that always saw the good in things. She was warm and engaging and had a wicked sense of humor, always making people smile. I became involved in patient safety as a result of my mother's death following adverse events that occurred when she was in hospital. As a result of numerous investigations, we learned that in the month prior to Mom's death, pharmacy techs were asked to prepare 35 bags of dialysate for the ICU units, and they followed a procedure that was prescribed in the pharmacy. Unfortunately, either the boxes of potassium chloride and sodium chloride were misplaced, or when the pharmacy tech went in to get the box that she was looking for, she picked the wrong one. So she followed the checklist very carefully. She made up what she thought was a very good, safe solution, and it turns out that it was poison. She had done what the system had told her to do, follow a checklist, and she had been caught by it and ended up with 2 deaths.
One of the key messages of Just Culture is that individuals are responsible for the actions that they take, but they're not responsible for how the healthcare system is set up, and so they shouldn't be expected to take responsibility for the system structure that may have influenced how things unfolded in a particular incident.
It was early on in my career when I was working in the intensive care unit. There was a code blue that was called, and I went down to this patient's room, and I was the first person to get there other than the nurse on the unit who had found the patient. And they were not breathing, they didn't have a heartbeat, and she was doing her best to try to resuscitate him on her own. And in that chaos, had pulled out the equipment, and it was pulled apart in many different pieces. So I got it put together, started to breathe for the patient. And then shortly after, the rest of the team came, and we actually got a pulse back on the patient and went to transfer him to the intensive care unit. And when I went to do that, I looked over and realized that he had been hooked up to medical air instead of oxygen. I was devastated. Even just telling you the story now, that sickening feeling just hits me in the guts again. That was many, many years ago, and that feeling never leaves me when I think about that day, that moment. There was only me and one other person that knew what had happened, and they wouldn't have said anything, and that would have been the end of it. But I knew that the right thing to do was to let somebody know what happened. I knew that that information would be important for the physician and for all of us to understand what happened to the patient, so it might change the course of action, how we treated that patient and what we did. And so after I got the patient kind of settled, I went and found the physician and told him what had happened. He was really calm. He didn't get upset. He thanked me for telling him. And I know that he then knew that information, and it did change the course of how we treated that patient, for sure.
Over time, as we have this sense of, oh, that's too bad that something happened, let's look at what was the underlying cause of that. How can we fix the things that anybody might have done in a similar situation so that it's safer next time round? Whatever the underlying cause is, if we don't have a situation where people feel comfortable making those reports, then we're going to never learn and improve at all.
In my mind, Just Culture is about trust. So if we don't have a just culture, people don't feel safe to talk about the problems in the system. They don't come forward. And if they don't come forward, then as a system, we don't learn from it, and we can't make things better. And so it all goes back to trust and people at that front line feeling safe to talk about the problems at the system.
The 5 principles of Just Culture actually spell an acronym called TRUST, and it really underlies the importance of creating a just culture. It relies on building trust. T in the word trust is to transparently inform everybody about how we do things around here, especially around how we respond to patient safety incidents, how we make it safe for people to feel like they're going to be assessed in the right way, that people really feel like they have confidence that they won't be blamed or shamed in their reporting or in the actions that they've taken, that really a good trust culture needs everybody to know what to expect when something happens. The second one is that responding appropriately. So when something does go wrong, we have a standardized way of assessing what happened so that we're looking not just at the actions of the individuals involved in an incident, but that we're also really paying attention to what influenced that incident. So that's what we call the system factors for looking at a broad perspective of what happened in that particular situation. So that's part of responding appropriately. The third principle in the word trust is U for understand. And in this principle, we encourage people to hold two ideas at the same time, that healthcare workers are human beings and human beings make mistakes. That is a reality of the situation, and that people also need to take accountability for the actions that they take. But within that, people take actions within a system. And so what are the things that led that person to take those actions is really the focus of where we want the assessment of a patient safety incident to be. The S in the word trust stands for support, and how really important it is to support everybody that is involved in a patient safety incident or who is impacted by it. So supporting the patients and the families, being transparent about what happened, disclosing what happened, supporting the staff who may feel really uncomfortable about coming forward, and how leaders respond to those individuals makes a really big difference. That really we take a learning system approach to understanding why an incident occurred. The T in the word trust really is that treating people respectfully, that we are respectful in those communications all the time. And so that's really a place where leaders can set a tone and really support people to be treated with respect. And so together, those 5 principles, spelling the word trust, is underlying what we are talking about when we're saying a just culture has these principles.
A just culture isn't just a one and done kind of thing. It is something that as an organization, as leaders in it, we have to constantly work towards.
By bringing healthcare providers and the patients together, it's my view that we prevent some of that damage that can be done when it's not the individual's fault.
We want all of our healthcare providers to know that they should report what happened, that they should feel confident that that information is going to be helpful and used for us to make the system safer, and that we're going to look and try to identify those system problems versus look at the person first.